News.
The Royal Flying Doctor Service provides essential emergency services to rural and remote Queensland families, and both major parties have promised millions of dollars more to keep the service going. The RFDS has welcomed the support but says there's a lot more to do to fix Australia's rural health crisis.
Every time an RFDS aircraft lands in a rural Queensland community, it can make the difference between life and death. But that's only part of the service offered by this much-loved institution.
At every stop that we have along the way, we have waiting lists. So, for instance, if we go to one particular community, we could be there 2 weeks. We could easily be there 4 weeks.
At a time when people in drought-affected areas are doing it especially hard, the Royal Flying Doctor is also delivering $2 million worth of free dental care every year.
We'll get families in. The kids are doing okay, but mum and dad have put their teeth on the back burner because it's just not feasible. They don't have that sort of money to get their teeth fixed.
For the first time in its long, distinguished history, the RFDS has inserted itself into the political debate, and it's worked.
I've also just this week announced $11 million to go to the Royal Flying Doctor Service for the continuation of dental services out in our rural and remote areas.
Federal Labor says it will match the Coalition's funding. However, the service also wants a public inquiry into health policy for rural Australia, as well as a plan to reduce accidents and injuries in rural areas. Frontline doctors say the initiatives are definitely needed.
There is a crisis out in the bush, and the need is greater than ever, and there is a gap in life expectancy between people that live in rural areas compared to the city.
Brianna Piazza, WIN News.